Students at Baylor College of Medicine have the opportunity to gain experience in diverse clinical settings. Harris Health System is the public healthcare system providing care to the residents of Harris County, the third most populous county in the United States. Ben Taub Hospital, the central clinical care facility of the Harris Health System, serves as a teaching hospital for all specialties and subspecialties, and includes a Level 1 emergency and trauma center. Lounge and relaxation space is available in team rooms and in trainee lounges for the various clinical services. There are also shared indoor and outdoor relaxation areas in the first floor cafeteria, as shown here. Here, you can see the emergency medicine lounge on the first floor with adjacent locker room space. Several of the lockers are designated for medical student use only. This portion of the emergency room is used by the psychiatry department. There are ample spaces for work, secure storage, and relaxation. Pictured here are some of the spaces used by trainees on obstetrics and gynecology rotations at Ben Taub. For obstetrics and gynecology, as well as many other service lines, secure storage space is available in team rooms and workrooms, which provide either padlocks or individual lockers. Here, you can see another example of department-specific areas for student use. Such spaces are often shared with residents, providing opportunities to meet and learn from resident educators. For students on surgery rotations, several work and study spaces are conveniently located near the operating rooms. Based on student feedback, a dedicated student workroom has been created within the previous academic year, which provides work, study, and secure storage access. There are several additional team rooms available for student and resident use. Pictured here is the team room for learners on neurology rotations. Like team rooms for other services, these spaces are multi-purpose, providing a combination of work, study, lounge, and secure storage spaces. If students desire more private study spaces, access is available to large and small conference and classrooms. Group teachings are often held in these rooms as well. The team room layout shown here for the internal medicine clerkship provides adequate storage, lounge, and study spaces, and supports a collaborative learning environment. Similar spaces are available for all departments, as shown here for psychiatry.
The Michael E. DeBakey Veterans Affairs Medical Center serves as the primary healthcare provider for more than 113,000 veterans in Southeast Texas. Medical students at Baylor College of Medicine have been fortunate to participate in clinical training at the VA for more than 70 years. Similar to other affiliates, there are some broadly shared student spaces and others that are specific to the service line. Pictured here is a conference room and adjacent team room for trainees on the neurology service, including both students and residents. Students have access to secure storage in lockers, ample workspaces, and can use the conference room for more private study time. Internal medicine, surgery, and psychiatry have similar spaces available for student use. The expansive size of the institution allows for generously sized team rooms. This includes lounge areas with plenty of room to put your feet up. Several large and small conference rooms are available at the Michael E. DeBakey VA, which can be used for educational conferences or as private study and lounge spaces when not in use. Working closely with leaders at hospital affiliates, we are continuing to enhance the quality and quantity of student spaces in clinical settings. Here you see an area open to all trainees and located near the intensive care unit. This particular space was expanded and updated to optimize trainee safety during COVID-19. Individual study carrels provide private and creative workspaces. Similar improvements are ongoing on the 4th floor of the hospital, which includes the creation of group and individual workspaces, lounge spaces, and even simulation education opportunities. Although overnight call is not required for any of the core learning experiences, secure call rooms and associated lounge areas are available for student use as flex spaces.
Texas Children's Hospital is an internationally recognized children's hospital and the primary pediatric training site for Baylor College of Medicine. The hospital system includes the Pavilion for Women, a state-of-the-art center for obstetrics and gynecology care. Baylor faculty also are the service chiefs and staff physicians of the hospital, which is ranked 3rd nationally in the U.S. News and World Report's list of America's best children's hospitals. Across both the Pavilion for Women and the pediatric units, there is an abundance of spaces for student use. Some areas are shared with other trainees, residents, fellows, and faculty as students work alongside all members of the healthcare team. As you can see, these spaces provide welcoming environments for study, relaxation, and secure storage for personal belongings. There are also myriad of education spaces, including small and large conference rooms, which can be used for teaching sessions or private study. There are additional public spaces for relaxation at the Pavilion for Women in the 3rd and 4th floor cafe areas and on the 3rd floor of the Mark Wallace Tower. Secure storage is provided to students by either requiring badge access or a keypad entry to team rooms. Some areas also have individual lockers or locked cabinets. We are very fortunate that education is well supported by our clinical affiliates, as evidenced by our spacious and dedicated areas for trainees. Student and house staff relationships are facilitated through shared resources, such as this recreational space on the 21st floor. With abundant storage and room to socialize, this area is highly utilized and much appreciated by a wide range of trainees.
Baylor St. Luke's Medical Center has served as a teaching hospital for Baylor College of Medicine medical students since 1961. The hospital is now a joint venture between Baylor College of Medicine and Common Spirit Health and forms part of the St. Luke's system. Baylor College of Medicine students train at Baylor St. Luke's Medical Center as part of core rotations in internal medicine and related specialties, psychiatry, neurology, and both general and specialty surgical services. Similar to other hospitals, there are department-specific locations for students to work, study, relax, and store personal belongings. Pictured here are such spaces for the neurology and internal medicine services. This dedicated student workroom provides work, study, lounge, and secure storage space for students on multiple rotations. Students appreciate the opportunity for a private space to work and relax alongside their peers. The conference rooms in the Cooley Building basement are also available for student use when didactics are not in session. Lounge, relaxation, and study space is available in shared areas such as the Cooley Building atrium and library. The School of Medicine leadership continues to work with the leadership at the clinical training sites to enhance resources for students and to ensure communication with students regarding the availability of study, secure storage, and relaxation spaces. Despite space-related challenges for all clinical personnel during the pandemic, the aforementioned efforts have been well received by students, as evidenced by the improved student satisfaction with student spaces in affiliate hospitals and clinics. We greatly appreciate the support of our clinical affiliates in ensuring adequate resources for medical students and other trainees.